abdominal pain. That is discomfort between the chest and the pelvic. It is common, and it can be because of excessive alcohol consumption, or unwisely eating, or tumors, or anxiety, or it can be also commonly a part of menstruation or accompanied with menstruation. It can be also more serious with endometriosis. It can be because of cystitis, because when there's obstruction for the urine to be passed, and it can be because of peptic ulcer, and it can be that there is a volvulus, so twisting in the intestine, and then there's ischemia, not sufficient blood supply. It can be that there is an organ having muscular spasm because it tries to overcome a stone or an area of inflammation. And if it is not so strongly, here is recommended to have a hot water bottle. If it is stronger, then medical attention should be sought, and also if it is accompanied with fainting or sweating, or if it is not released by vomiting, or if there is persistent vomiting, or vomiting with blood, or blood in the feces. And there are also, against peptic ulcers, antacid drugs. And there can be done examinations. There can be done colonoscopy, gastroscopy, ultrasound, laparoscopy, and that is according to Illustrated Medical Dictionary, written by Sue Davidson, Penny Preston, and Francis Williams, on page 4. But this is no substitute for medical knowledge, or it is also not medical advice. Hi and welcome. I'm trying to learn medicine today, abdominal pain, and after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's very obvious. Abdominal pain, discomfort in the abdomen. So we did it in anatomy, the region between the chest and the pelvis. Abdominal pain, discomfort in the abdomen. Mild abdominal pain is common and is often due to excessive alcohol intake. Excessive alcohol intake. So it is common that people have abdominal pain because of excessive alcohol intake, or eating unwisely. So we're eating too much, do we say? Eating unwisely, or an attack of diarrhea. I forgot to say it. We're talking about internal anatomy and stuff like that, and medical things, and this is no medical advice, as it's apparent. I'm just reading and trying to understand it. Pain in the lower abdomen is common during menstruation, but is occasionally due to a gynecological disorder such as endometriosis. Endometriosis. Okay, it is common with excessive alcohol. It is if someone eats too much, or eating food which is. So if you're staying with eating unwisely, it can be also having food which is not so good digestible for the person. And it can be an attack of diarrhea, and also it is common during menstruation, but it can be also because of endometriosis. Cystitis is a common cause of pain or discomfort in the abdomen. Cystitis. Cystitis, inflammation of the bladder lining, usually due to a bacterial infection. Cystitis, inflammation of the bladder lining. Bladder distension as a result of urinary obstruction may also cause abdominal pain. So bladder distension, I think that means not going to the toilet, I think. As a result of urinary obstruction may also cause abdominal pain. I don't know what distension means. And if there's a problem with urinary obstruction, it can also cause abdominal pain. Abdominal Colic is pain that occurs every few minutes as one of the internal organs goes into muscular spasm in an attempt to overcome an obstruction such as a stone or an area of inflammation. Abdominal colic is pain that occurs every few minutes because one of the internal organs is going into muscular spasm because it tries to overcome some obstruction like a stone or an area of inflammation. The attacks of colic may become more severe and may be associated with vomiting. See abdomen acute. So attacks of colic, pain every few minutes, can get more severe, associated with vomiting. When we're getting more severe. Peptic ulcer often produces a recurrent gnawing pain. Other possible causes of abdominal pain are so peptic ulcers can be there. They can make a lot of pain. And other possible causes of abdominal pain are infections such as pyelonephritis and ischemia, that is lack of blood supply. As occurs when a volvulus, which is a twisting of the intestine, obstructs blood vessel. Okay, it can be infection, like pyelonephritis. It can be ischemia, so lack of blood supply, which happens when the volvulus, which is a twisting of the intestine, happens, and that obstructs the blood flow. Tumors affecting an abdominal organ can cause pain. So also tumors affecting the organ. Abdominal pain can also result from anxiety. So anxiety itself, the behavior, can cause abdominal pain. For mild pain, a wrapped hot water bottle is often effective. Okay, a hot water bottle for mild pain, and we have that again with no medical advice. Pain due to peptic ulcer can be temporarily relieved by food or by taking antacid drugs. Okay, if it is a peptic ulcer, food can help, specific food, and by antacid drugs. Abdominal pain that is not relieved by vomiting. So people can have abdominal pain because they're about to vomit. It's less of a thing with the excessive alcohol. Whatever. So if it's not relieved by vomiting and it's longer than 6 hours, or is associated with sweating or fainting. So if a person is sweating and fainting or something of it that's longer than 6 hours and there was vomiting happening but it hasn't gotten better, requires urgent medical attention. Urgent attention is also necessary if pain is accompanied by persistent vomiting of blood, or passing of blood-stained or black feces. Unexplained weight loss or changes in bowel habits should always be investigated. So if a person loses a lot of weight, or if the bowel habit changes. I don't even know what bowel habit is. I don't really understand what the bowel is. Investigation of abdominal, but I think I'm getting closer. I think it is just the whole part from the stomach onwards. Investigation of abdominal pain may include the use of imaging tests such as ultrasound scanning and endoscopy examination in the form of gastroscopy, colonoscopy, or laparoscopy. That was a medical part. If you were here for medicine, you can go directly to the next part of medicine. And we will continue reading all about something. This was not medical advice. If you stay here, participate in standing yoga and spiritual onwards. The feet are standing together. Breathe in the feet outside. Out the arms down. In and up. Out and down. In and up. Out over to the side. In and up. Out over to the other side. In and up. Make an inch space between the feet and open it to the side. In and up. Come up onto the toes. Out the hands down. In and up. Out over to the other side. In and up. in and up. Out and down, lean onto the knees. Breathe again in. And out, make a head with the back. In middle. Out the belly. In middle. Out the head. In middle. Belly. In middle. Out, come with the round back. Back at the top of the shoulder roll. Breathe with the hands up, come up onto the toes. Breathe out, down feet together. Breathe in, bend right leg. Breathe out, stretch left leg. Breathe in, change. Out, stretch right leg. In, change. Out the left leg. In, change. Out the same time. Breathe in, lift the right hand up to the sky. Bend the left knee. Breathe out, look to the sky. Inhale, down. Out, down. Breathe in, left hand up to the sky. Bend the right knee. Breathe out, look to the sky. Inhale, down. Out and down. Make a head with space between the feet. Shift back to the heels. Breathe in and out. Out and up. In and down. Out and up. Take hold of the elbows and gently rock from side to side. Hands again down, feet together. Breathe in halfway up, straight back. Out and down. In halfway up, straight back. Out and down. Breathe in, hands again up. Bring your hands to touch, lower the hands down to heart center. The torso point to the outside. Breathe in the arms up. Breathe out, sink down. Elbows against the insides of the knees. Breathe in, straight down. And out and come with the back up. Breathe again in. Out and down again. Elbows against the insides of the knees. Breathe in, straighten up. Out, it comes in one straight line up. Hands again down. Breathe in, hands up. Out, sink down. Breathe in, straighten up. And out, come in one straight line upwards. Hands down. The next exercise can go onto the back. Breathe in. Out, go with a straight back in front. This can go onto the back. Make a round back and come with a crown of head first up. Out and down. Again in. Out in front with a straight back. Make a round back and for crown of the head first up. Feet together. Breathe in the arms up. Out, one hand down. In and up. Out the other hand down. In and up. Lean back, draw the shoulder blades together. In and up, intertwine the fingers, reach high. Out, reach out all over the back. In and up. Steady your around. Out in front, out of the back. In and up. Lean back with long arms, draw the shoulder blades together, now the elbows down. In and up. Out and back with long arms, draw the shoulder blades together, elbows down. And just back with the long arms, breathe out. In middle. Out and down. Breathe in the arms up. Out and down. In and up. Hands to touch and lower and down. Das war's, Yoga. I thank you very much and until next time.